And again, the reason we're talking about this is the flattening the curve has been a really key terminology for how our response to the pandemic. But as we're seeing through the World Health Organization, through the UN, everyone is also starting to recognize that we are likely to face a mental health epidemic as well. And we need to do the exact same type of interventions to make sure we flatten our mental health curve and actually ideally shift the curve to the left in the first place. As you can see with the data on our slide here, polls are really showing that US adults are struggling. 45% said the pandemic has affected their mental health. And if you kind of look out a little bit, a lot of the more recent surveys are showing even higher percentages as the time goes on through April and now May. And so the anticipation is that the distress people are feeling due to lots of different factors is going to increase. Another source of data here is if you look up the hotlines around the crisis text lines and the National Suicide Prevention Hotline, they've increased by 116 and 300% respectively. And additional newer data suggests even higher fold increases over the last month. And so this is something we have to be prepared for, and we can do preventative measures to, again, flatten our curve. For me, I believe in one of the core tenets of well-being is that if my expectations are aligned with reality, I can manage most things. When those things are not in alignment, I struggle and I can be taken by surprise. And so I think it's useful for us to have a sense of what can we learn from history? What can we learn about our emotional phases of disaster response? And I think one caveat we should be aware of is that this disaster response model is designed for a solitary moment disaster, a 9/11 type of moment. And I think as we go along with our pandemic, we're recognizing that this is going to be a more prolonged type of disaster. But I think the phases are still instructional for us. I think we're obviously in the midst of the impact currently, and as I said, I think it will be more prolonged. But as healthcare professionals, we are seeing this heroic honeymoon phase where people are rallying around each other. The community is rallying around healthcare professionals. We're feeling like we are flattening the curve around this virus. And so there is this sense of accomplishment and purpose and mission that is sustaining us, and it is incredibly important. As we look out 3 months, 12 months, or variable amounts of time, then the next phase is disillusionment, though, and that's something we need to be cognizant of. There are a lot of reasons for this disillusionment, and the types of emotions that come with it are varied as well, including sadness, grief, anger, resentment, etc. And if we understand some of those emotions and their cause, I think we can do things to decrease the steepness of the disillusionment curve as we come back to our new normal and our reconstruction. It's also, I think, important to recognize the reconstruction phase has some fits and starts. We have to prepare that it's not a linear line, that there will be setbacks, and I think being prepared for that will allow us to deal with them emotionally in a better way. As mental health professionals, I think we have two roles here. Our first role should be in this current impact honeymoon phase, and this is where we can, again, I think, try to flatten the curve, shift the curve left as we provide support to people, as we provide stress first aid. And in the second half of this graph, our role will frankly be frontline providers. We will have to use our specialized treatment to provide for those people that have been injured by this epidemic. I think one of the things as mental health professionals on the line we wanted to go over was a little bit about this stress first aid, stress continuum model. This model was born out of work with firefighters in their training manuals and also first responders. But I think whether you're looking at our stress continuum model or you're looking at psychological first aid, these frameworks allow us to think through how we can be helpful to people that are not actually already mentally ill. And I found that out firsthand as we were trying to create a peer support program for our healthcare professionals with our psychiatry department. And people were more than willing to volunteer their time, volunteer their services. But one of the things I got back from a lot of psychologists and psychiatrists was, I actually don't know about the stress continuum model. I don't provide psychological first aid. I'm a specialized treatment provider. Can you help me a little bit with that? And so I thought that was a reminder that there may be some basic concepts that we can go over so that we can provide this care well. I think the first concept is really recognizing the sources of stress. I think being a little bit more nuanced about our terminology can actually be really helpful, both for us, but also our patients or our colleagues, so that we can create and craft interventions that are actually hitting their source of stress, not stress generically or broadly. The division here is kind of 4 sources of stress. One is, of course, life threat and traumatic injury, exposure to death and injury. 2 is loss and grief. I conceptualize grief pretty broadly here, right? Obviously, we think about loss and death, but I think people are grieving their sense of normal. They're grieving graduations, weddings, conferences, where I get to see my colleagues and present the research we've been working on all year. Grieving when is this going to end, grieving the school year and the structure that parents have with their families. All these are sources of grief and loss, and important to recognize. Number 3 is the moral injury concept. Certainly where we began with this was, are there going to be enough vents out there? But as we've spent some time over the last 2 months looking at this issue, there are lots of various forms of moral injury that healthcare professionals are facing, whether that's the visitor policy and hurting that sense that no one should ever die alone. That is not happening right now in places, and I think there's lots of other examples where some of the care that we're providing in the pandemic may not be within our normal moral framework during normal conditions. And the last one is the wear and tear fatigue injury. This, frankly, we were dealing with significantly even before the pandemic for physicians that we'll talk a little bit more about later. But again, I think it's important for us as leaders, as physicians, as citizens, to recognize that fatigue is coming from many different directions right now, as people are really having to deal not only with the fatigue of endless shifts, or additional hours in the hospital, they are dealing with the fatigue of being teachers, being caregivers to elderly parents, being neighbors. All of this is cumulative and can cause our stress meters to really reach their peaks. I think what's unique about the pandemic is generally most people are experiencing 1 or 2 of these sources of stress at a time. Right now, it's a very real possibility you're experiencing stress from all 4 of these buckets. And that's what's causing the meter to stack up pretty quickly. The other issue, of course, is that when we try to decrease our stress meter, the strategies we use, some of those are not available right now. And so that combination of more stress and decreased ability to decrease stress is a difficult position for all of us to be in, and I think explains some of the earlier data we saw. I'm a silver lining guy. I think the silver lining from this formation is that, as far as I know, the mind and the body aren't able to differentiate where the stress is coming from. That cumulative nature is really the issue. And so sometimes when I'm speaking to healthcare providers or patients, they say, well, there's really nothing I can do right now about this moral injury issue. We can debate that, but there are definitely places where that may be totally true. But that just means that we have to really focus in on other sources of stress where we do have some control in decreasing them, because the end game is really making sure that stress meter stays low enough so that we're not injured and hurt by it. The stress meter helps us kind of recognize where we may fall on our stress continuum model. And so this is, again, a nice model to me in terms of having a shared vocabulary with yourself, with your patients, with the people you interact with and colleagues, so that we can kind of talk about how are you doing in a way that can decrease stigma and not pathologize normal. And so generally we can think of green as being ready, healthy, fit, ready to go. Yellow is reacting, and common emotional states around that can be feeling anxious, drained, sore, down. Orange is more injured, where we can feel hurt, distressed, symptomatic, and out of control. And then red is certainly illness, where we're clinically symptomatic, clinically hurting our functioning. The truth is, a lot of us are yellow right now, and frankly, were before the pandemic. And to me, I just want to really give voice to that, because if you're feeling irritable or anxious or drained, I don't think that that means there's anything abnormal about you or mentally ill about you. I think that that's the situation we find ourselves in right now. What that does mean, though, is that we are at greater risk of moving into orange and moving into red. And so we have to redouble our efforts to consider our tools that we have and the tools that we use to move back over as far as we can into the green range, or have as much wiggle room on the yellow so that we can tolerate the continued stress hits that we are facing right now. It also can give you a sense of, I'm asked a lot of how do you know someone's in the illness range versus just kind of dealing with reality? Again, these emotions, their pervasiveness, the severity of those emotions can give you a little sense of, hey, is this person somebody who's really, in the midst of this, or is this somebody who we should start referring to treatment, whether that's through their PCP, which is how I kind of think about it in terms of orange, or if they're in red, they really need specialized mental health care. That's a little bit rough, but that's how I think about it. Christine, any thoughts on that?
Totally agree with everything you're saying. Love the thought that there's no need to pathologize things that are very normal human responses, but it also doesn't mean that we do nothing about it, and that we can just be so much more proactive in thinking that through. And the way that I think about it in the most top line, 30,000 foot view, is all of us as healthcare professionals are human beings at the end of the day. We all have our physical health and we all have our mental health. And that is true whether we have medical conditions and whether we have mental health conditions. We have our health and all of its axes to take care of. And I really like this model, because hopefully it might give people a little bit more tangible sort of data points to help gauge, where am I? Where do I tend to go from here if I just let things be as usual, versus when I've tried various strategies in the past that might help it to shift a bit more towards the yellow or green.
Mm-hmm. Thank you. I think that's a great point. Yeah, Rachel.
Yeah, no, it made me think about some of the conversations that we've had as we've been preparing for this. And I know one of the things that's come up a lot, especially from Yuji in the conversations we've had, is it's okay not to be okay right now. And I know with the three of us, when we were talking about titles and everything, we threw out that optimizing, because optimizing right now is really not a realistic idea or achievable goal. Managing is a much better way to think about it. And to the hope that you both always instill, this is a continuum, so there's always a way to get back to the green. So I think that the points that you've made are really beautiful, so thank you.
Sure. I think one last thing is there's this green to orange arrow that I think is important to recognize too. As I talk to physicians right now and other healthcare providers, are like, I've never had an issue with this. I don't understand what's happening. I've never been anxious. I've always slept well. And so there are generally additive things that kind of move us through this continuum, but there are certain things as toxic stressors that can skip a phase. And I think we're having the potential to face some of those right now. And so that may be explaining a little bit about people that are like, I've never had an issue, what's going on? So I just wanted to highlight that as well.